According to the National Center Post, 1 in every 10 soldiers in the Gulf War have been reported with treated PTSD symptoms, and 20% recorded victims from Iraq and Afghanistan War, leaving a 30% lingering number from the Vietnam War. In 2009, the nation estimated that cost for treatment ranges from $4 billion to $6.2 billion over 2 years. Today, there are more than 400,000 untreated cases of post-traumatic stress disorder among veterans.
What is PTSD?
Post-traumatic stress disorder is a reaction to harrowing events or one event that can cause anxiety and depression, and just a generalized feeling that you're not safe or that you can't ever be safe.
The basics of it is, any adjustment that somebody would need to make after coming back from a deployment.
My definition of post-traumatic stress disorder is a condition that happens when a service member experiences a serious shock or something that dramatically affects their feelings and their emotions.
When asking treatment options off the top of their heads, this is what they concluded to.
There's lots of treatments out there right now, starting just from command chaplains to Wounded Warrior programs have it, Fleet and Family Support Center, right up to the chain of command. From the most senior enlisted personnel should ask their LPO, chief, officer. Lots of help is out there. Somebody just needs to seek it.
There are a lot of treatment options. There's counseling available, there's psychiatric care available, there's questionnaires that people fill out after they come back from being deployed. There are so many. There are a lot of options out there.
Some treatments that I'm aware of is group counseling, individual counseling, depending on how severe, medication for depression or anxiety, something like that.
Why do you think there is a reluctance to seeking care?
Well, I don't know if I agree with the word victim, but why are they reluctant to seek care? A lot of it has to do with pride, I think. A lot of us in the military are type A personalities. We don't like to admit that there may be something wrong, or we're not as strong as we thought we were. So I think maybe that has a lot to do with why people don't seek care, other than some people may think that it can affect their career, but I think the military has kind of gone above and beyond that. There are a lot of things in place that soldiers and sailors and Marines can go and utilize counseling-wise that is private.
A lot of people just don't want to admit that they have a problem. It's just like anything else. They don't recognize it or don't want to address it.
Well, some service members are reluctant to seek care because of their specific duties that they do. They don't want to be labeled to having PTSD, not being able to continue their duties, or coming out of the military, having that label and not being able to get a certain type of job.
No, I don't think that there can be anyone that's in the military today that hasn't heard about it.
Without treatment, how does PTSD impact their lives?
There's a lot of ways that it can affect one's life. People can actually spiral out of control. They can self-medicate with alcohol, drugs, which are all contrary to the military's behaviors that we're looking for them to have. They can be depressed to the point where they're not showing up to work on time. They're oversleeping. There's a lot of
If not treated and hidden, it can build up and cause someone to take it to the extreme level where they cannot control themselves. And another could be where also going untreated, they can severely get sick themselves.
What is a
Website.
veteran, and how are they significant to places such as Hampton Roads?
A veteran is anyone who served in the military, from Coast Guard to Secret Service, FBI, to any of the 4 branches, Army, Navy, Air Force, Marines, and regardless if they've done 6 months or 30 years, that's a veteran. And how they affect the Hampton Roads area is that they give back to the community once they retire. I, like myself, giving back to the community, being a teacher. Some people come out and be police officers, or firemen, or some congressmen.
With the community working together, how can we decrease the silent number of victims?
Really just making people aware what treatments are out there, identifying the symptoms, and recognizing that there isn't a negative connotation to it.
Well, I think the active duty military system is very efficient. I think that system is hard to beat right now. There is a lot of services that are available for active duty service members. I think maybe where the services could be better is in the Veterans Administration and the VA system, where some of those hospitals are overloaded with people, with patients, not enough providers that can get in and they can evaluate these people that are having some problems.
Making more sailors, service members, Marines, soldiers aware that it can be treated and is accepted, and if society accepts that they have this condition because of something happened, it can be treated better, just like a police officer can experience PTSD or a fireman. So,
What are some symptoms to look out for?
I mean, things change all the time, you know, all situations change. But I think it's others that see changes in you when you come back.
Aggression and worried or claustrophobic, those are just some. Or if they see another trauma or somebody getting in an accident can link something else, so they're not going to be the normal self that you perceive them to be happy. They may close themselves off, or they may become abruptly not comfortable with themselves or their surroundings.
What would you say to someone with these symptoms?
Moodiness, depression, just having trouble coming back into society after, or to the family even after being gone for such a long time. So really just the readjustment process of being gone.
I would tell my brother or sister veteran that they may need to seek help, seek counseling, see a doctor, see the vet, or the VA hospital or something like that, so they can take care of themselves.
What would you say to someone experiencing symptoms of PTSD?
I would tell them that it's alright to go seek help, and that they're not going to be judged, and there's lots of different places that they can seek help from, as long as they feel comfortable.
Just point them in the right direction on where and how to try and get help.